In this video, I want to be talking all things knee. I want to talk about where you get your pain in your knee might give you some indications of what's going on and what you can do about it. So let's go. Thanks for checking out the channel. My name's John. I'm the head therapist here at John W Sports Injury. Here at this channel, if you are new, you need to know that we want to do 3 simple things for you. Help you to understand your body so you can get rid of any pain and weaknesses and strive forward and hit your health, well-being, sport, exercise goals. So as we're making our way through this video, if you find it to be helpful, please do me a favor and hit that like button so that I can see these are the type of videos that you want to be seeing. And if you do want to see more of our stuff, why not subscribe? But let's talk about the knee. Now, what we're going to be talking about today is if we get a general pain running across the top of the knee, pains in the joint line space, pain on the inside of the knee, outside of the knee, and the back of the knee. So we're going to cover all of those areas today and what structures might be affected if we're suffering with those things. So let's start with perhaps what might be the most common thing we see in clinic, which is a pain running over the top of the knee. You might typically get this walking up the stairs or even down the stairs. Perhaps if you're doing long distance sports like running or at the end of sports matches that you start to get this pain going across the top of the knee. What's going on here? Well, what we need to understand is that we have a tendon, quite a large tendon called our patella tendon or quadriceps tendon running over the top of this kneecap, and it comes down and it attaches into this small bony lump that we have called our tibial tuberosity. Now, if we know that a tendon attaches muscle to bone, we want to be thinking about what's acting on this tendon that could be causing our pain. So this is our quadriceps tendon. So we have our quadriceps, our 4 strong muscles in the front of the leg that attach to this tendon that crosses over the kneecap. So what we generally find to be happening here in this general sort of patella tendon area is that we're having too much force applied to that tendon. And what we want to do is establish why we're getting too much force being applied through that tendon that's causing that pain. That could be a tightness in a quadricep muscle. It could be a tightness in a hamstring muscle that's causing an unhappy relationship between those quadriceps or hamstrings. It could be a weakness in our glutes that's causing us not to have good knee stability. There's multiple things. And what I would say is as we make our way through this video, if you are suffering with any of these things, I would always recommend that you get a medical specialist to check out exactly what's going on, because what I'm giving here is general guidance. But what I'm going to do is put a link in the description below with a more detailed video around patella tendinitis. But if you are someone who's suffering with this dull, diffuse pain coming across the top of the kneecap, it's definitely one to go and check out and see if that could be indicative of the pain that you get, and ultimately try to correct the force being applied to there, or the additional force being applied to there, so that you can settle your pain. Now, on that note, if you get a pain that's quite localized and almost at the base of the kneecap or what we call the patella has an apex, almost like a triangle shape at the bottom. And at the bottom of that, we have what we call a fat pad. Sometimes we talk about these as bursas, but what they are is essentially a little fat pad that separates the tendon from rubbing on the bone. But if we get this dysfunction in this area, that can often become inflamed and very sore. So that can be helped by applying something like ice for 5 to 10 minutes on the area, whilst also correcting the additional forces that are going on in the area, which, as I said, will be more information in the patella tendinitis video. And one quick note is that if you are somebody who's below perhaps 12 to 16 years old, or you're talking about or thinking about somebody who's suffering with these pains, that might be something slightly different, particularly if the pain is on this bony lump here. We call that Osgood-Schlatter disease. It's a growth-related condition, again being caused by additional forces being applied to that area. But check out the video below on Osgood-Schlatter disease for more detailed information around that. So that's dull, diffuse pain across the front of the knee. What we also then want to talk about is pain in our joint line here. So you can palpate your own joint line by almost trying to find the bottom of your femur bone, which comes almost like a dog bone, if you like, at the end, and you feel the heads. And then you get your upper leg bone or lower leg bone, so the top of your lower leg bone that we call the tibia. And then we have that space in between. So we were talking about the patella tendon coming through here and the kneecap. If we drop off the sides of that, you'll find yourself in the joint space. Now, in here we have what's called our meniscus. Our meniscus are 2 discs that are there really to act as our shock absorbers and to stop those bones rubbing on each other. So if you're getting some localized pain in that area, and what we can often feel is like a catching in the area, or a particular sort of clicking in the area, that might be something that lends itself towards a meniscal tear. Now, if you are thinking that you have an issue in your meniscus that isn't sort of getting better, again, this is one I would definitely recommend getting checked out. It might be that a scan is needed to establish exactly what's going on and the right sort of treatment protocols for you. But that would be a meniscus issue in that joint space. Now, if we're suffering pain through the inside of the knee here, what we have in here is what's called our medial collateral ligament, or sometimes we talk about that being the MCL. Our ligaments, very much like our tendons join our muscle to our bone, our ligaments join bones to bones. So they take, if you like, the bone above the knee, below the knee, and they connect those things together. So they provide stability for the joint. So if you're finding that you're getting pain and also perhaps a sort of almost like a giving way sensation or a wobbling sensation, and the pain's very localized to this inside line of the knee, that might well be an MCL injury. Again, one to get checked out, but what we want to do really here is focus on trying to restore your balance. You might find that your balance has become difficult because the ligaments help with that balance, and again, some anti-inflammatories into the area can really start to help out. But what you really want is a progressive loading program that's going to slowly start to load the knee appropriately and at the right level to build your strength back in that area. Now, likewise to the MCL, we have the similar structure on the outside of the knee called our LCL, our lateral collateral ligament. So again, if you're getting that pain on the outside of the knee, that might be very similar. These injuries can often be caused by an acute incident, so perhaps a buckling in of the knee, but they can come with overuse conditions as well. But on the outside of the knee, we have a couple of other things that could be going on. Now, if the pain is a little bit wider, and again, if it's very localized to what we call your fibular head, which is the outside, if I just show you here, the outside of the knee here. Now, what we've got here is a bony lump. It's on the top of the lower leg bone, the outer lower leg bone. And what we have coming into here is a structure called your iliotibial band. This is a big band of what we call fascia running down the outside of the leg. And if you're a runner or no runners, they'll probably be quite familiar with the ITB or the iliotibial band. It's much talked about in the running community. And that's because this condition we actually call runner's knee. And this is where if we get a lot of force being applied to that fascia, typically from the hip area being the cause, that can cause a real rubbing effect. We call it iliotibial friction syndrome because it rubs on that fibular head and causes an irritation. So if your pain is very wide, and if it's something that's being experienced when you're doing something repetitive at the same speed, so lots of running, lots of cycling, lots of walking, that might well be runner's knee. And again, in the description below, I have a video where I talk about that condition in a little bit more detail. So if we then move on to the back of the knee, again, the back of the knee is a little bit of a junction back here of many structures. So firstly, if we put our knee onto bend, and we can feel these two, I always call them like guitar stringy-like structures, but structures just almost above the knee running into the back of the knee. These are our hamstring tendons. So again, they're the tendons. Tendons are joining muscle to the bone. So they are taking our hamstring muscles and attaching them to the bone so that they can create movement at the knee. But if you're getting pain on those structures or in the back of the knee, it might well be that that's a hamstring strain, and that's something that you can look to be addressing those hamstrings over. We also have a muscle in the back of the knee in that space there that we call the popliteal muscle. Again, so if you've got a very localized and almost you can often feel like a lump or small lump in the area that's sore, we term that a trigger point, that might be a popliteal dysfunction. What we also have is our calf muscles coming up, and the hamstring tendons and the calf muscle tendons almost sort of cross over. So as I mentioned, that junction in the area. So if the pain is sort of slightly below the knee, but when you palpate down into your calf, that starts to feel sore, that might be letting you know that you have a little bit of a calf strain related issue into the back. We also can get a fluidy lump in the back of the knee, relatively commonly, and we call these Baker's cysts. They often settle down on their own, but again, if it's not settling down, that's a sign that there's some inflammation going on, and that would be where I would strongly recommend getting that looked at to establish what's causing that Baker's cyst and what's the best thing to do about that. Finally, we also have two very important structures in the back of the knee that we call our cruciate ligaments. You may have heard the term ACL, which stands for anterior cruciate ligament. We also have our PCL, which is our posterior cruciate ligament. The ACL, much better known, mainly because it's much more commonly injured. They form a cross at the back of the knee. So they literally sit as a cross on the back of the knee. Now, these are something that often are caused by an acute incident, often having our foot planted and then a rotation happens above the knee, and that can strain those ACLs, often results in a lot of pain, a lot of swelling. This is something that if it's suspected, we would really encourage an urgent MRI to understand exactly what's going on. But if you're feeling pain in the back of the knee and you're noticing a lot of giving way or that the knee doesn't feel very stable, that is certainly something that I would look to get investigated. So that's a quick summary of the knee. As I said, what I wanted this to be is real general guidance. So we have, just as a quick recap, the structures over the top of the knee that we often term the patella tendon. We have the MCL, we have the LCL, we have our meniscus sitting in the space. Right on the outside here, we have the ITB coming in to attach. We have our hamstring tendons, our calf tendons, our cruciate ligaments, and the popliteal muscle. So there's quite a lot of structures that can come into play here, which is why I would always recommend getting it checked out. But if you do have any questions, feel free to drop them in the comment below. The one other condition that I wanted to mention before we finish is arthritis. The reason that I haven't put it into the main body of the video is that to a certain extent, I believe that we all suffer with some aspect of arthritis. It's a degenerative condition that happens over time. But what's key to understand about arthritis, and I'll put a video in the description below in a little bit more detail, is that ultimately we just want to make sure that we're not applying excessive force to the knee so that we can manage those symptoms. And actually, by doing that, we can lead a fully functional, healthy life as a result, even if we have some signs of arthritis. Obviously, if that develops, that's something that can be further investigated and talked about. But I hope that content's been helpful. If you've made it to the end of this video, well, that's incredibly flattering for me. I'm glad that you've done that. I hope that you have enjoyed it as a result. And if you have made it, hit that like button so others can see this video, and hopefully it can be helpful to them as it has been for you. And I will be updating you on our next video. And so if you want to see that, make sure you hit that subscribe button. And here's another video that can help you on your health and wellness journey. I'll see you on the next video.